Hello and welcome, everyone. Thank you for joining us for our webinar presentation today, Macro Trends Shaping Recruitment Plans for 2025. My name is Ron Hoppe. I'm the CEO of Worldwide Health Staff Solutions, and it's our pleasure to bring these webinar presentations on a regular basis to both our clients as well as our applicants. I believe today we'll be joined by both clients and applicants. And we're always excited when we have one of these topics that's kind of a crossover to both of those groups. As always, at the outset of our webinars, we always appreciate for those that are attending, if you would just take a moment and in the chat section of your screen, let us know where you're joining us from. If you're from outside of the United States, we are always interested to see all the countries in the world that we are reaching with these live presentations. So please just take a moment to do that. The presentation today is going to be one where we are certainly going to welcome questions as well as your perspectives. So as we go through, if you agree with sort of the information that's being shared, or perhaps if you have a slightly different view or a slightly different interpretation, please feel free to share that through the chat section on your screen. We welcome all input and feedback, and when you do that, it also makes these sessions somewhat more interactive, and we'll try to engage with your feedback as much as we can in the time that we have today. As always, we try to keep these sessions to 1 hour maximum, and we will do that again today. So without really any further introduction, let's jump right in. It's really hard to believe that we're closing in on the end of 2024. Another year that's gone by quickly, and certainly a year that has seen many interesting developments, issues, opportunities when it comes to healthcare human capital management. And I know from speaking with many of you that there's certainly a lot of thought being given to what 2025 may look like. And we're going to together explore some of these things today for certain. So CJ, if you could go to the next slide, please. So I think as we prepare to look at macro trends for 2025, it's always good, I believe, to have a slightly bigger picture perspective. So if we look at 25, I think it's helpful for us to understand where have we come from in more recent times. Have we, what was going on in 2023? What have we experienced in 2024, and how might that inform how we go forward into 2025? Becker's, many of you will be familiar with the Becker's publication, and each year, at the end of the year, they publish a survey of healthcare executives. And that survey is asking them what are their biggest issues, biggest concerns heading into the new year. So the survey going into 2023 that Becker's did, and the findings were that the number one issue on the mind of hospital executives was workforce shortages. That was followed by financial challenges, and that the third highest priority item heading into 2023 was behavioral health and addictions issues within the workforce. Remember, in 23, we were just kind of at the very tail end of COVID. And, there's been obviously a lot of discussion that's taken place of, the impact that COVID had on the workforce in many different respects. So those were sort of the macro issues heading into 2023. Next slide, CJ. Let's take a look at what those same how those macro issues going into 2024. Very interesting. At the outset of 2024, the number one issue on the mind of healthcare executives was data and digital health. Digital health, we could do a whole session on virtual and digital health, but data was really what stuck out to me. The interest and the need for more data, more sophisticated data to help manage all aspects of a healthcare organization. This was the number one priority, and we've seen some of that translate across the work that we're doing in terms of information and reporting that our clients are looking for as part of their overall management programs and structures. Workforce shortages remain very, very high on the list of healthcare leaders, number two, and that was followed by financial challenges. Financial challenges coming out of that adjustment period of the pandemic ending, kind of returning to what would be sort of a new normal in operations, and just the financial challenges that came with that. So these are really what have been some of the big driving forces and big factors that employers have been focused on in 2024. And again, we can definitely relate in terms of the experience and the interactions that we have with our clients, that data is very important. Obviously, workforce shortage, workforce issues, super high priority. It drives a lot of what's happening, and it contributes to some of the financial challenges as well. In fact, I just read in Modern Healthcare this morning, and not to get ahead of ourselves, but that upward pressure on wages and salaries is going to be a major concern for healthcare leaders in 2025. But let's take a look at some issues and some trends in a little bit more detail that I think you may be familiar with. And some may be new information for you. But just before we do that, in addition to the priorities heading into 2024, I think there's some other noteworthy happenings from 2024. Again, we'll just touch on for a moment to help us with our perspective as we consider 2025. So noteworthy happenings in 2024. Firstly, the number of U.S. domestic RN graduates reached record level highs. We're in the United States now graduating right around 200,000 registered nurses annually. Now, obviously, not all of them are immediately available for work at the bedside where they're most urgently needed, but just on a relative basis, a big priority for workforce planning in the U.S. is we have to educate and graduate more nurses, and we're doing that. Again, that number is approaching 200,000, and I think we can expect to see it to continue to rise. At the same time, the international candidate pool, as defined by nurses educated and living abroad who have passed the U.S. NCLEX exam, are also at record level highs or near record level highs. 2023 set the all-time record for the number of new NCLEX passers abroad at just right around 55,000. We think that number is going to be down just a little bit in 2024 to about 46,000. But even that number is very elevated level compared to even 22 Obviously, the number of graduates was very low during the COVID years, but going into COVID, those numbers were somewhere less than 20,000. So very strong international pool together with very high levels of new US grads. Other noteworthy happenings in 2024 for those of you in the long-term care sector, the federal staffing mandate was kind of brought forward, and that's out there. That and everyone's trying to figure out how to deal with that. From an international perspective, visa processing times fluctuated over the course of 2024, and we're going to look at that in a little bit more detail here as we go along. And then, of course, in November, we had a little something called the US election, and everybody is very interested and perhaps concerned about what the outcome of that election might be on health policy generally. But we're going to spend some time from our perspective talking to that point or that issue from the perspective of international recruiting. So next slide, please, CJ. So when we talk about the growth in the US domestic graduate population, the good news is, as I shared, we're at record level highs. And for the last 4 years, the number of domestic RNs passing the NCLEX licensure exam has increased by about 4% per year over the last 4 years. So a very healthy rate of growth. Over that same 4-year period of time, the number of international nurses passing the NCLEX exam increased by more than 40%, so 10 times the rate. Now, 50,000 international graduates or 45,000 international graduates NCLEX exam passers up against 200,000 US grads may seem like a relatively small number. But when you consider the workforce that you might be able to tap into overall, it does represent, actually, the international candidates do represent a very significant proportion of that workforce. I'll just comment here briefly as well. This is not new information, but I think it's always important to recall and remember. While the domestic grads and the number of domestic grads is great, and employers are hiring them at very high numbers, the reality is the challenges that healthcare systems face in nursing is really twofold. One is there's just not enough people to do the work. And secondly, as great as it is to hire new graduates, employers also desperately require candidates that have some experience. And this really is where that international candidate is able to make a significant contribution, because when they do come to the United States, the candidate pool that we work with generally is going to have 3-4 years of experience minimally, and probably more than that. 6, 7, 8, 9 years is not an unusual amount of experience. So good news, domestic grads, all-time record high, international candidate pool strong. So these are all very positive factors, macro factors that I would say are at play headed into 2025. And the challenge for employers will be to find the right balance between their various current efforts related to retention and similar activities, together with the right number of domestic grads to bring on and add to the team, and then considering how do you also find those middle-level experienced nurses that are so valuable and so needed in the workforce. CJ, next slide, please. I mentioned how the international candidate pool is strong, how it has been strong. Here's just a quick visual representation of that. We're seeing in the work that we do, the number of nurses from the greatest number of countries that we've ever seen in the many years that we've done this work. Historically, when you thought international recruiting, you would have thought, or your mind would immediately go to Philippines and India. But today, with the adoption and the acceptance of virtual interviewing and remote work, we really are able to access a truly global pool of candidates. And while countries like Philippines still represent a large proportion of candidates, we're finding many Filipino candidates working in other countries at the time that we recruit them. And as well as we're able to connect with really strong candidates in various places in Africa, in South America, as well as Europe, Australia, New Zealand. So the international pool of candidates is more diverse than it's ever been, in addition to being as large or larger than it's ever been. Next slide, please, CJ. One of the things that I mentioned as a noteworthy event from 2024 was the implementation or the introduction of this federal minimum staffing levels for long-term care. This is going to be a very significant issue over 2025 as employers prepare for this requirement and how they're going to comply. An initial study found that of the for-profit long-term care providers currently today, only 11% of the organizations would actually be in a place where they are in compliance with those requirements that are coming. 41% of nonprofit long-term care providers would currently meet those requirements, and 39% of government facilities would meet those requirements. So there's a lot of work, and I think in the long-term care sector, this is going to be a key focus, a macro focus for sure, over the course of 2025. And for any of our long-term care providers that might be joining us today, I'd certainly be interested in any thoughts or comments that you might have from your perspective on this development as well. Next slide, please. When the conversation of international recruitment takes place and as employers consider how to implement an international recruiting program as part of their overall staffing strategy, a key question always is, what are the visa processing times? How long is it going to take? And again, this is just a simple visual representation to give you some indication of how volatile, maybe volatile is a bit too strong of a word, but just how visa processing times fluctuate from time to time. This is data going back quarterly back to 2018. So you can see that some time ago, back in 2020, visa processing times were approaching 40 months. And then as we went through the COVID years, you'll see there's kind of a period of flat line there showing 12-month processing times. And the reason for that is during the COVID years, there really were very, very few visas being issued. And therefore, unused visas from the COVID years were made available in subsequent years. So there was a bigger supply of visas than the annual quota that exists otherwise. And even though the visa priority dates during that time were reported as being current, it was still taking 9, 10, 12 months, 13, 14 months for processing a visa application, with the visa priority date being current for most of that time. You can see since COVID, there's been some times where visa processing times have been elongated somewhat through 22, 23. We had some periods where processing times were back down to that sort of 18-month time frame. There was a short time this summer, late summer, as the annual allotment of visas was fully utilized, that processing times spiked up for just a short period of time, came back down closer to that 2 years. We always talk about processing times being 18 to 24 months. Right now, we're kind of at the upper end of that 24 months in terms of processing times for new applications. We're cautiously optimistic that we'll see those processing times come back closer to that sort of 18, 20-month time frame here in Q1 of 2025. We watch this data very carefully on a monthly basis, and we update this chart as well on a quarterly basis as well. So you can see that visa processing times do fluctuate, and we'll comment a little bit more on that and just how to think about the time frame that is required. If you've never utilized international recruitment as part of your strategy, you'll say your reaction might be 2 years is such a long time, and agree, it is a long time. And if you have utilized international recruitment maybe in more recent times when processing times have been shorter, you're wondering why processing times are a little bit elongated now. But there is, I think, a way of kind of looking at this from a perspective that can be helpful in your longer term planning, medium to longer term planning. Because the reality is the workforce challenges that were identified by hospital executives in 23 and 24, these weren't new issues, right? Workforce issues have existed for many years, and workforce challenges are going to exist for the long foreseeable future. So given that reality, how do you properly consider or assess how and whether international recruitment might fit into your plans? Next slide, please. I mentioned earlier that going into 24, data and technology were high priorities for healthcare leaders. And this, I believe, is going to continue to be a macro factor as we go into 2025, even related to all things staffing. Staffing decisions, as those of you that are employers well know, are becoming increasingly data-driven. This is not to say that data wasn't being used previously to manage staffing strategies and staffing programs, but the extent to which technology is now available and technology is being used is growing very, very rapidly. And so we here at Worldwide Health Staff Solutions are preparing to be able to support our candidates and our clients through technology. We've been, over the course of 2024, working on both a client portal as well as a candidate portal. And we look forward to the first iterations of those being rolled out here in the first part of 2025, as we also want to make sure that we're able to support your tech and data needs. We're seeing from our clients and just across the industry as we speak to individuals, the demand for real-time information. That's both on the domestic side, per diem, direct hire domestic, um, even contingent labor, travel labor. There is now a demand and an expectation for sure on the domestic side for real-time information. And we're working hard to be able to provide that level of data transparency and information transparency as it relates to international recruiting as well. And of course, with the technology, it requires significant investments many times to first stand up programs and systems and then to maintain them. And technology and data is being used ever more extensively to help drive and evaluate return on investment of various staffing strategies and to come up with what optimum models are to staff a program or staff a facility in a way that is optimized financially, that is optimized from a worker engagement perspective, uh, all the while supporting the highest possible levels of patient care. So data and technology is something that we're very focused on and something that we intend to bring forward to our current and future clients over the course of 2025, just as part of this macro focus that is in healthcare today related to data and technology. Next slide, please. This is, I thought this would be an interesting representation as we talk about the impact of the US election. And we've received many, many questions related to our assessment of the impact of the US election on international recruitment in particular. And I want to take just a few moments to kind of speak to that from our perspective. I'm not a political commentator, and we're not gonna try to make any political comments here. But I think there are some interesting insights that we can have to ensure that we have a proper perspective on what we might expect from an immigration perspective, holistically, and then more specifically from an immigration perspective as it relates to legal employment-based immigration to the U.S. So the reason I've listed all of these presidents here going back to Bill Clinton is to make this point. Registered nurses from abroad come to the United States almost exclusively as permanent residents. The permanent residence visa program is also known as the EB-3, or more familiarly as the green card visa. The green card visa, permanent resident visa, this is a visa that never expires, never needs to be renewed. And as I said, this is the visa that is used probably for 99% of all registered nurses coming to the United States. It is our opinion, supported by 30 years of experience that I'll comment on in a moment, that the outcome of the election is almost certainly going to have no impact whatsoever from an immigration perspective on the EB-3 permanent residency green card program. This program has been in place for many years. It has been virtually unchanged since the Clinton administration. It has been virtually unchanged across a number of both Democrat and Republican administrations. It is not controversial in any way whatsoever. And when you speak to folks in Washington that are very much focused on the immigration issue overall. So the good news is, it is our expectation from a macro perspective headed into 2025 that the impact or the outcome of the U.S. election will have no impact, no adverse impact on the functioning of the EB3 permanent residency green card program that nurses use. That's good news. We all are looking for some more good news, and looking for this program to be modernized and to be updated. It is a quota-based system, and it operates today with quotas that haven't been updated in the last 30 years. And obviously, the U.S. has changed a lot. The profile of the workforce has changed a lot over that time. The population of the U.S. has increased significantly over the last 30 years. So there certainly is a need to update and modernize the program in terms of making more employment-based visas available, making processing times faster. So we are cautiously optimistic about that, and I'll comment further about that in a moment. But in terms of the core of international recruiting, it is our opinion that, and we hold this opinion strongly, that we don't expect any adverse impact from the outcome of the U.S. election on that specific program. There are other considerations for other employment-based visa programs. I would say specifically the H-1B visa program. So if some of you in your organizations are using the H-1B program for occupations like physicians, possibly IT professionals, finance professionals, and the like, it is likely that the H-1 program, which has been more controversial over the years, will probably get a closer look. I don't see there being any restrictions placed on that program. I just see that the applications themselves will likely get looked at a little more closely. And I have read some proposals recently where the cost for accessing and processing H-1B visas is likely to go up as well. Going forward, I mentioned that we are looking for the EB3 program to be updated, to be modernized, and to be more responsive to employer needs, and not just healthcare employers. This program is open to really all sectors of the U.S. economy. So our view of the likelihood of there being some visa relief in terms of additional visas being made available, visa processing times made more streamlined. It is our view that as a result of the U.S. election, that there actually is a slightly favorable likelihood for that happening than has previously existed. And the reason for us holding this opinion is not based on the party that's coming into power, but rather it's based on the reality that we now have, for the first time, I think, in 6 years and maybe even longer, a situation where you have one party controlling the White House, the Senate, and Congress. And we're hopeful, cautiously hopeful, that in that political environment, that we will see some common sense, real world, practical solutions being able to rise to the top and actually get implemented. Where in more recent times, the political maneuvering and the political rancor between the parties basically made progress on many issues virtually impossible. So we are very confident that the outcome of the election is not going to be disruptive to the current mod or the current program for recruiting international nurses. And we are cautiously optimistic that in the coming year, that proposals such as the Healthcare Workforce Resilience Act, which was now been introduced in the last 3 sessions of Congress, that legislations like that or very similar to that is actually going to make some progress with the potential of actually being implemented. Because that legislation in particular has enjoyed fairly broad bipartisan support in the past, but not to a point where both sides were willing to come to an agreement, because they just weren't willing to agree on just about everything. So I'll stop there with sort of Ron's political insights, but we are cautiously optimistic that we will see some improvements and some beneficial movement, both in terms of the number of visas and the processing times for visas. Next slide, please. So with that, again, I just would invite if you have any thoughts or any questions about anything that's been shared this morning, to take a moment and just put those in the chat section. We'll be happy to respond and engage with those as much as we can in the time that we have remaining available to us. Interested in feedback and opinions from both clients, employers, and candidates as well. Just before I call on CJ to sort of help moderate any questions that may have come in, I mentioned earlier the visa processing times, and just how to think about how do you utilize a program that's going to take some time to produce a desired outcome, and how that might fit into an overall strategy. If you're a talent acquisition professional or human resources executive responsible for the staffing in your organization, you're well aware of the challenges that you face today. You're aware of the openings that you have, the volume of contract labor that you may be using, or perhaps the revenue that you're foregoing because you're not able to operate your facilities at optimum capacity. That information is obviously what you work with each and every day. But as you consider, how an international recruiting program might fit in 2025, one way of thinking about the timeline is to also take a look back. Take a look back to where your organization was in its staffing profile and staffing challenges 2 years ago. Were your openings more, less, the same? Hard to fill positions likewise? How's your contingent labor spend today compared to 2 years ago? For many employers, they've actually been able to bring domestic contingent labor costs down somewhat, but we're starting to see that to tick up again. Very interesting to see how that's unfolding. But when you consider where you were 2 years ago in context of where you're at today, also take some time and try to think through, given the information you have today, where you expect that your organization's going to be at 2 years from now. It sounds like a long time, but it does go by very quickly. And regardless of the type of program that you're looking to implement, whether it's a scholarship program with local colleges and universities, various types of incentive programs, incentive retention programs, these programs all take time to implement and to generate the desired outcome as well. So we find that when organizations take a look at where they're at today, where they were at 2 years ago, and where they expect to be 2 years from now, it just helps to provide a perspective of what can we do today to help prepare for where we think we are going to be 2 years from now. And there's obviously a number of things, um, including international recruiting. But the thing with international recruiting is once you initiate a program, if you stay with it, if you build a pipeline over time, in time, you will start to have a fairly predictable flow of candidates that you can then use that information to also inform your domestic staffing strategies as you go along. I didn't include a lot of data on this. I think it's generally understood and generally accepted. And if someone has a different point of view, I'd certainly love to hear it. And it's this. I believe that the data tells us very clearly that the workforce challenges that healthcare employers have today, in fact, the workforce challenges that employers in America generally are having today in terms of shortages, I think the data very clearly tells us that the challenges going forward are going to get greater and not less. We see the expected demand for healthcare services to grow at a rate in excess of the ability of the workforce to produce a proportionate increase in the number of workers. That's clear. We also see that we're about to embark on a period of time where the number of high school graduates in the United States it's slightly started, and it's going to continue to decline for the foreseeable future. That is tied directly to the US birth rate, having drifted down consistently now for many years, but most specifically the last 18 years. The birth rate has declined significantly in the United States. So our ability to produce high school graduates and university and college graduates is going to be constrained by that reality. That reality could in part be offset in the future by dramatically increasing the number of foreign students that would be attending and graduating from US colleges. That would be one potential strategy. But when you consider that the challenges are likely to increase and not decrease, looking at what outcomes you might need to have 2 years from now, 3 years from now, 4 years from now, international recruiting can certainly play a very significant part in supporting a longer term strategy of that nature. So with that comment, I'm going to stop talking for a minute and ask my colleague CJ if we've had any questions come in.
Hello, Ron. Oh yeah, so for now, I don't see any questions from the chat. So it looks like everyone's still thinking through, or perhaps a bit shy to ask. So while we wait for questions to come in, here's like a quick question: what if we are an healthcare employers and we want to work with worldwide health staff? How would we get started?
Yeah. Well, the first thing is generally just to have a conversation, right? We would have a conversation. We, from our perspective, would be interested in learning about an organization's current situation, their current priorities, their current challenges, things that they might have done in recent times that have contributed to their current state positively and not positively. So I think first and foremost, it's not just this is international recruitment. This is how it's done. The application of international recruitment is different in each organization, depending on just where they're at. And then obviously, having a very transparent conversation about what the potential and what the limitations of international recruitment may be as well, right? We're never going to solve any organization's staffing challenges 100%. And there's a variety of reasons for that, but we can certainly make a meaningful contribution. So it's really learning about our client's organization, ensuring that they have a good understanding of what's possible and what's not, and then starting to craft a strategy from there. And many times strategies don't need to be some big, elaborate, large-scale undertaking. We work with many clients where we will start a process that includes a relatively modest number of nurses to get a process started, to get an organization familiar with the process, and to begin to build a pipeline over time. That's really the clients that generate the most significant benefit from working with us, working with a direct hire permanent placement model with international candidates, are those that adopt this pipeline strategy of starting some candidates in process, continuing to evaluate expected needs, and then calibrating that pipeline by adding additional candidates at various times, either in lesser or greater numbers, so that that pipeline is going to produce the type of results that will support the anticipated needs down the road.
All right, thanks, Ron. And here's another question. So in some similar sessions about retrogression, I saw like a comment that they said this stretch of retrogression will take 3 years, and we're already on 2 years or so. Do you believe that it will take 3 years for this stretch?
Yeah. So I think I understand that question. I think the question is, do we think retrogression is going to extend out to 3 years? My opinion, based on available information, is that is not going to happen. We expect, as I said earlier, in Q1 of 2025, for processing times to come in slightly from where they are currently at. The last month, I think 25 or 26 months, we're expecting to get back closer to 20 months, I believe. And then, as I mentioned, we're cautiously optimistic that as we get into 2025, we'll have additional visas made available, which would have the immediate impact of shortening processing times, because processing times are nothing more than the outcome of there being more applications in the system than there are available visas. If there were more available visas, you would see the processing backlog come down very, very quickly. So I do not hold the view that processing times can get significantly extended. But then again, nobody has visibility. Nobody has visibility into the number of applications that are in process at any point in time. And that's ultimately what drives the processing date. But we're very comfortable that processing times are going to stay close to where they are. Anticipated improvement and modest expectation of some legislative and regulatory relief.
All right, thanks, Ron. And yeah, I see one question. I think this one is interesting. This is a question from Meredith. Do you assist international candidates with licensure, which is NCLEX? And how many international nurses do you work with per year on average?
Mm-hmm. Okay, so Meredith, thank you for that question. So the answer, there's a couple of questions here, really. is, do you assist international candidates with licensure? The answer is yes, we do. We have an entire dedicated licensure team. From the client's perspective, though, it's very important to note that where our clients are recruiting international nurses, every one of them is already an NCLEX passer. They have already passed the NCLEX exam by the time that, or prior to the time that we would even present them for consideration and for interview. So do we assist international candidates? Yes, we do. With NCLEX exam, most definitely. For our employers, we're only going to present you with NCLEX passers in almost every circumstance. So that answers the first part of your question. The second part of the question is, how many international nurses do you work with per year? I think I can interpret that a couple of ways. How many international nurses do we work with? So one measure would be the number of international nurses who are NCLEX passers, new nurses that apply to us every year. And I would answer that question by saying, for the last number of years, statistically, one out of every 3 NCLEX passers in the world is submitting their resume to Worldwide Health Staff Solutions. So by that measure, we're working with somewhere in the range of 20,000 plus, upwards of 20,000 plus NCLEX applicants the last couple of years, maybe a little bit less, 15,000 this year, so a lot. The number of nurses that we place each year is, I would consider that to be somewhat proprietary information, but it's in the thousands. And we have seen that number grow over the years, and we expect to see that number grow again going into 2025.
Okay, thanks, Ron. I think that's it for our Q&A session. So just want to ask, what are your final thoughts for this question?
So CJ, I see there's just one further question that's come in here. Is if we could summarize what the Healthcare Workforce Resilience Act seems to do, or
I see
intends
that.
to do. So this is as I said, this is a piece of legislation that's been introduced now in the last 3 sessions of Congress, and it's kind of evolved. It was initially positioned as a COVID relief bill to support staffing needs during COVID. And more recently, it's been repositioned somewhat as just a general workforce bill with a bit of a rural healthcare focus to it. But the long and the short of the Healthcare Workforce Resilience Act is to make an additional number of visas available specifically for doctors and nurses each year. And the current draft, I think, provides for 45,000, that there would be 45,000 visas, additional visas specifically made available to doctors and nurses. Won't get into the weeds too far on just how that 45,000 number is calculated. Because of the contentiousness of just around immigration generally, politically, in recent years, what's really unique about the Healthcare Workforce Resilience Act is it seeks to utilize previously authorized but unissued visas from prior years. So this hasn't been the case in recent years, but as we go back, maybe even as far back as 2000, there have been times where the annual quota of visas has not been fully utilized for a variety of reasons, including processing inefficiencies at various times. So there is a very significant number of visas that have been authorized over the years, but were never issued. The exact number isn't exactly known, but it's estimated to be several 100,000. So the thought process is to ask for 45,000 visas out of 200,000 or more is a fairly modest request. And also the thought process is it shouldn't be politically contentious, or at least in the, in our current or prior context, because it's not requiring any additional visas to be authorized beyond those that already were authorized. So recapture existing visas from previous years, dedicate them specifically to doctors and nurses. We think the passage of the Healthcare Workforce Resilience Act would dramatically improve processing times, and it would also allow for a very significant increase in the number of international nurses that could come to the U.S. every year.
Oh yeah, thanks, Ron. Yep. So yeah. So any final thoughts for this?
No, I think that's it. I see from some of our candidates that have joined us as guests today that there's some specific case-specific questions. If you're working with us, I'd just recommend that you communicate closely with your case manager. They're in the best position to help you. Please continue to monitor our social media channels for information on other upcoming webinar topics. We try to cover a very, very broad range of topics that are of interest to candidates, that are of interest to employers as well, our clients. So we try to address as many topics as we can. We do that on a weekly basis. So please be sure to follow us on Facebook or on LinkedIn for the latest information on upcoming webinars that are presented by our colleagues, by guest presenters. And we also post all of our presentations on our YouTube channel, so they're there for you to go back and reference or to share with others at any point in time. I'll just say thank you to everyone for joining us. Thank you for your interest. Please let us know if we can assist you in any further way. Candidates, please continue to work closely with your case manager. Thank you for joining us, and wherever in the world you may be, I wish everyone the very, very best as we enter into this holiday season here in America and Canada and many other parts of the world. Wish you all the best. Wish you to have a great time with your family and friends. We look forward to a terrific 2025. We're optimistic, and we look forward and appreciate the opportunity of continuing to make an impact on the lives of our candidates and an impact on the lives of the patients that our candidates are able to care for when they arrive in the United States. Thank you, everyone. Merry Christmas. We look forward to talking with you soon. Bye for now.